Hello everyone and welcome to my channel PhysioSaurus. In today's video we are going to learn about the myofascial release. Alright, and since it's a huge topic to deal, so I'll just make the video in series wise. Okay, so this is the first part of the video on myofascial release or MFR. Alright, now before understanding myofascial release you need to understand what is fascia. Okay, so let's discuss this term. Okay, so fascia is a sheet or it's a blanket which covers all the vital structures of your body, vital organs of your body. Okay, so it is a thick connective tissue sheath. All right, and it protects all the structures of your body including your vital organs. Okay, now fascia extends from the inner aspect of the skull to soles of the foot. So you could also say that fascia is one of the most largest part of your body. Okay, now it is present from interior to exterior part of your body. It has sensory receptors, and when you say the term fascia, it itself includes all the soft tissues of your body such as your ligaments, your bursa, your capsule and everything. Okay, now it protects all the vital organs too. Okay, also it binds with the muscle of body and thus it provides support. Okay, so it also helps in stabilization of the body posture. Okay, and it is also sensitive to mechanical load. Okay, so when you will apply load on it, when you will apply pressure on the fascia, it will give you response. Okay, we will learn about what kind of response will it give, okay, after a few minutes. Okay, now the next line, it also bear loads and it contracts and relaxes just like a muscle. Okay, next point, it distributes the forces of contraction of the muscle. Okay, it distributes the force of contraction to the agonist and the antagonist muscle. So it basically helps in distributing the force of contraction. Okay, and it is always under stress whenever you perform any work. Just like a muscle, fascia is also under stress. Okay, now let's talk about the elements of fascia. Okay, so it is made up of collagen, elastin and a ground substance. So ground substance is just like a base. Okay, so ground substance surround the collagen and the elastin fiber. Okay, now let's talk about this collagen. So collagen exists in a viscous gel fluid which is known as your ground substance. Okay, and the function of the collagen is to provide strength and stability. Okay, whenever you apply mechanical loads on the fascia. Okay, and elastin provides the elastic quality or stretching quality while absorbing the tensile force. All right, now what is this ground substance? So ground substance lubricates the fibers and it reduces friction when fibers glide over each other. Okay, so during contraction the fibers glide over each other and this ground substance lubricates the fiber and it reduces the friction between the fibers. All right, now the highlight of this whole MFR thing is that gentle, light and sustained touch is essential to avoid resistance offered by the tissues while performing MFR. Okay, so basically when you are performing the MFR, the load or the pressure should be gentle, light and it should be sustained touch. Okay, so it should be continuous for a longer period of time. Okay, to avoid the resistance offered by the tissues. Why? Because resistance offered is directly proportional to the velocity of force applied. So basically the more force you will apply on the tissue, the more resistance you will feel. Okay, and you just want to feel the less resistance. So gentle, light and sustained touch is required while performing the MFR. So please keep this in mind. Okay, now let's move on to biomechanics of fascia. All right, so it contracts and relaxes just like a muscle. Okay, it has elastic or stretch property. Okay, now during loading, okay, so fascia contracts during loading and during unloading fascia relaxes and returns to the original position. All right, So the function of the fascia is very similar to a muscle. Okay. Now let's say that a loading on the fascia is for a longer period of time. Okay. So if loading is sustained over a longer period of time, then it will lead to deformation of the fascia. Okay. And at that time MFR is very useful. Okay. Now let's talk about the connection between the muscle and the fascia. Okay. So muscle and fascia are inseparable. That means that they cannot be separated. Okay. So together they function as to enhance the body posture. Okay. And it kind of balances the body. Okay. So muscle and fascia are inseparable entity, and fascia moves in response to muscle activity. All right. Now fascia enhances the body's posture balance. All right. Now these are the function of the fascia: cellular respiration, elimination of toxins, metabolism, fat storage, conservation of body heat, repair tissue or tissue healing, okay, and fluid and lymph flow. All right. Now fascia is again of two types: superficial fascia on the superficial level and deep fascia on the deep level. All right. Now superficial fascia, it attaches dermis skin to underlying tissues and it acts as shock absorber. Okay. And if superficial fascia is damaged, then it causes abnormality of the tissues. Okay. But deep fascia, it surrounds and separates the visceral organs. Visceral organs are your stomachs, your intestines and all. Okay. And it works as to stabilize the body posture. Okay. And let's say that the deep fascia is injured, then it will lead to compartment syndromes. Okay. So if superficial fascia is damaged, then it will lead to tissue abnormality, but if deep fascia is damaged, then it will lead to compartment syndrome. Okay. So during compartment syndrome, fasciotomy is performed to release the tension of the compartments. All right. Now adhesion in the visceral fascia, visceral means organs. Okay. So adhesion in the visceral fascia can create pain and discomfort, and then it can lead to dysfunctioning of the organs. All right. Now these are the condition that affects the fascia. So the first one is injury, second one is any kind of inflammatory process, and the third one is prolonged poor posture. Okay. Now let's read some guidelines before applying the MFR. Okay. Now in MFR, the therapist applies pressure on the client's body. That's our first point. Second point, assessment for MFR is done to palpate tightness, restrictions and adhesion. Okay. So these are the things that causes pain and discomfort in a patient. All right. This is why proper assessment is very important. Okay. Now in order to prevent slippage on the skin, because manual contact is required in MFR, so MFR is performed without oil or any kind of lotion. Okay. Now next point, slow sustained pressure, okay, held at the barrier of the tissue resistance. So whenever you feel, let's say that you have assessed the patient, okay, and there is a certain point where you have found that there is adhesion. All right. So over that area you will apply slow sustained pressure. Okay. And it is generally for 5 minutes and all. Okay, without slipping over the skin. Right now I am not dealing with any kind of techniques. I am just giving you an overview, or you could call it as a guideline. Okay, so don't misunderstand it as a techniques. We will discuss about the techniques. There are lots of techniques in the MFR also. Okay. Now pressure is applied towards origin of tissues from the painful area and then release it. Okay. So pressure is applied towards the origin of the tissue. Okay. And from where you will start applying the pressure? You will start applying the pressure from the painful area. Okay. So you will start applying pressure from the painful area and you will go towards the origin of the tissues and then you will release it. Okay. Now MFR has three things. Okay, so we need to discuss three things about MFR: the techniques, the unwinding, and rebounding. Okay, very important. This is the heart of the MFR. Okay, this is the heart of the MFR. All right, now before discussing the techniques, unwinding and rebounding, you need to understand few terms. Okay, and these terms are your contraindication, equipments and room preparation, correcting body mechanics. Okay, mental preparation, sorry, I have written here mental retardation, mental preparation. Okay, mental preparation of the patient, and therapist and client communication. Now let's discuss this first point. What are the conditions in which MFR is contraindicated? So the first one is alcohol and drug use. Second one is febrile state or the high temperature. Third one is systemic infection. Fourth one is cold and flus that are contagious. Then acute circulatory condition and acute blood disorders. All right, deep vein thrombosis and aneurysm. All right, uncontrolled hypertension, which usually involves anticoagulant therapy. Okay, then there is severe undiagnosed swelling, severe undiagnosed pain, undiagnosed lumps, rapid weight loss or rapid weight gain, undiagnosed breathing difficulties, undiagnosed bowel and bladder issues. Okay, there are some more contraindications to MFR, such as open wounds, suture, healing fracture, skin hypersensitivity, infectious skin condition or heartburn, radiation therapy, localized infection, cortisone therapy, osteomyelitis, okay, osteoporosis, rheumatological conditions, and severe varicose veins. So these are the contraindications. Now let's talk about the equipments and the room preparations. All right, so clean, warm, quiet and comfortable treatment room and music if required. All right, second point, chair for the client and somewhere safe to place belongings. Okay, coat hanger or hook on the back of the treatment room door, robe or dressing gown to use if the client needs to leave the room to visit the toilet. Okay, consultation form, body diagrams, case notes, spare paper, pen, pencil, these are the things. Then there comes the sturdy treatment table, preferably adjustable with a face hole or face cradle. Okay, therapist stool, two pillows, bolsters, towels, sheets and a blanket for draping the client. Okay, then there comes the therapist treatment tools, hand sanitizer and tissues, spare hair tie or band, and water for therapist and clients. Okay, so these are some room preparation thing, how you would prepare your room and what are the equipments that are required. Okay, so first 2 points has been discussed. Then comes the correcting body mechanics. All right, so proper body mechanics includes using the correct treatment table height or taking care of your own body if you work on the floor. Okay, next point, wearing adequate and appropriate clothing and footwear. Okay, third point, keeping your head up and your back straight, because you shouldn't have low back pain while treating your own patient, because otherwise you will need a physiotherapist to treat your own back pain. All right, fourth point, lunging from your legs as opposed to bending from your hips. All right, because that will cause the low back pain. All right, maintaining a center of gravity to conserve biomechanical energy and also use it to its full potential. All right, bringing the physical and the energetic power of each technique from your core while maintaining a relaxed body. Okay, making use of the width of your treatment table and positioning clients so you don't have to stretch to perform the techniques. All right, engaging the techniques, you are performing with your entire body and mind. maintaining a soft and sensitive hands and allowing them to listen to what they are doing, okay, and remembering to breathe. That's very important. You shouldn't panic while treating your patients, okay. So you should always have a correct body mechanics, okay, so that you don't hurt your back. Next point is your mental preparation, which includes mentally preparing the patient for MFR therapy, all right. And then comes the therapist and client communication, which is very important. Communication is very important, okay. So you will just talk to patient, you will tell them what is this MFR procedure, you will tell all the indications and the contraindications and everything about MFR. You will basically educate them, okay. Now let's talk about the effects of and responses to MFR, okay. So MFR, it could be painful first of all, okay, but it does not injure the client, okay. So keep this in mind, all right. So MFR could be painful, but it does not injure the client, okay. Now it could be painful because MFR breaks up the cross linkages between the collagen and the elastic fibers, okay, and then it reorganizes them so that the length of the fascia goes back to normal position, okay. So this is why pain occurs, okay. Now creeping, stretching, tingling and twitching like sensation under the skin, okay, or skin becoming pink in color as a result of MFR. So these are the response of the client's body to MFR, okay, because of the restricted collagen and elastin fibers, okay, which separates the ground substance, all right. So these are the, you could say that the response of the client's body, okay. Some more responses are breathing changes. You will notice breathing changes, you will notice skin color change, sweating, shivering, trembling, vibrating, shaking. These are the things, okay. Local or full body movement, okay, which is known as myofascial unwinding, okay. I'll discuss about what is myofascial unwinding in upcoming videos, all right. Then there comes the emotional release such as cry, laugh, anger, fear, okay, all these things. Then comes the effects of the MFR, okay. So therapeutic pain, better sleep, lethargy, less painful menstrual cycle of women, old aches and pain, and energized patient, okay. So these are some of the effects and the responses of the MFR, all right. Now there comes the assessment part. So few things that are very important while assessing the patient for MFR therapy, okay. So these are your posture, which includes your pelvic, jaw, foot, leg observation, all these things. Then your gait pattern. Then comes your orthopedics assessment. I've already made a video on orthopedics assessment. You should actually watch that video. And I've already made a video on a special test also, okay. So you can find the links in the comment box or in the description box below, okay. Then comes the goniometer measurement, which is used for measuring range of motion. Now I have made a separate video on goniometer, and I have made a practical video on goniometer describing all the things such as how you can measure range of motion of shoulder, hip, pelvis, everything, okay, everything. So you could find that video in the goniometer playlist, all right. The last one is your palpation. Now in palpation there are a very numerous number of things that you palpate, okay. So I'll discuss that in the next video, not in this video. So thank you so much for watching this video. The video ends here, all right.